Dr. Tan Wu Meng.
Sir, health goes beyond any hospital or clinic, especially for seniors and folks with chronic diseases. It's about living healthy and being supported in staying healthy. Homes, families, neighbors, communities, all coming together. And the social environment makes a big difference to whether a senior citizen falls ill, whether a sick patient can receive treatment at home or near to home, or recover at home without being admitted to hospital. So community and social support are very important. And this is something that we've seen even in the developed nations. Even in Switzerland, with their Swiss standard of living, they have learned this as well. For example, in recent years, in the past few years and going back further decades, hospitals in Switzerland have discovered that increasingly patients are being admitted for social reasons because the patients can't cope at home. It's been published in the literature even as far back as the late 80s by researchers in Switzerland, and these are lessons we can draw from all around the world. It's also worrying when social deterioration becomes medical deterioration and hospitalization, because a long stay in a hospital bed leads to deconditioning and loss of physical strength, makes it harder for an elderly patient to get back on their feet with the same energy as before. Ultimately, there is no place like home for health or for healing, and we should try to find ways to keep health and maintaining health to be focused on the home and the community, with hospital care needed only when deeply necessary. The Singapore Medical Journal recently published a study by SGH doctors. They looked back at 16,000 patient journeys, patient histories. They found that in Singapore, patients staying in public rental housing had a 30% higher risk of being frequently admitted to hospital, even after adjusting for demographics and clinical conditions. So there's room for us as a society, as a community, to learn and improve. We need to look at social care and healthcare as different aspects of the same goal when looking after seniors, and all the more so with an aging population and smaller families. The family is still core, but we should find ways to involve the community more. Young Singaporeans with a spirit of volunteering, or seniors who are energetic and want to reach out to their peers in friendship and fellowship. Can the Minister tell us how we can strengthen community support for seniors in a sustainable way? Furthermore, social care is also about urban design. As I spoke about in the budget debate last year, urban design can contribute to community engagement or to social isolation. In Clementi, some older blocks have flats which cannot accommodate the wheelchair ramp designs with the traditional HDB ease program. This means seniors with mobility needs find it harder to go out, see their doctor, or participate in the community. So at the whole of government level, we can look at ways to keep seniors in the community more and to keep them healthy. Mr. Speaker, in my maiden speech, I spoke about how we must be all of us, one Singapore family. May our people always grow closer and stronger, at home and in the community, in sickness and health, all of us, one Singapore family.